Welcome to Clyde Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome. Thank you, Dr. Tomaszewski from the Clyde Health Laboratories for joining us today.
Glad to be here.
As everybody can see, we're practicing social distancing ourselves, but we did want to spend some time with you. We know you're extremely busy, yourself and the team at the labs there, talking about the testing that's going on right now at the Clyde Health Laboratories and how you guys are helping out in this fight right now. So if you can, tell us a little bit about the Clyde Health Labs.
So Clyde Health Laboratories, about 350 people all told, and a good number of them, about 200, are here in the Center for Laboratory Medicine at Millersport and Flint Road in Williamsville. And this is where we have all our central virology testing. So we've been very, very busy the past 3.5 weeks. And we brought up 10 assays for respiratory virus panel. One, what they call an emergency use assay for COVID testing, and we're actually right now doing validations. We're starting validations for another platform of assays, which will be a lab-developed test, which is a specific for a high-complexity laboratory. We can do this kind of work. And then we're working with our partners at Erie County Medical Center. They're also looking to bring up a lab-developed test assay. So there's a heck of a lot of work going on. If you count it all up, that would be 11, 12, 13 assays inside of 3 weeks, which is light speed for laboratory test development.
So when you say all that work that's been done in such a short time, but that really is because of the public health crisis that we're facing and how, labs, and in particular the Clyde Health Laboratories, has been thrust to kind of the front of the news cycle, or to the front of the news. So tell us a little bit how you guys have had to respond.
With innovation, I'll say. Organization had to really shift our resources to this crisis. And so a lot of it has been focused on our virology laboratory, but it's touched all parts of the laboratory, all the central laboratory, all of the essential service laboratories that are in each of the hospitals. Everybody has been impacted by this epidemic and all this testing initiative.
Dr. T, it seems like there's an awful lot of technology involved in some of the things that you've been working on the last week or two. A lot of it's been done behind the scenes. Tell us a little bit more about that.
The very first thing that we had to do was the respiratory panel, and we accomplished that in about a week. And that gave clinicians a way of sort of identifying other pathogens before we got to the COVID testing. So that's still very important because, people get influenza and other respiratory viruses. This was a bad influenza year, a bad RSV year. And so we have all of that in a high sensitivity molecular assay right now, which is sort of best of class. The next thing that we had to do was to figure out what we were going to do with the COVID testing. And at that time, there was just a CDC test available. And that CDC test was adopted by the county first. And it's a very hand-intensive, handcraft type of test. So that test, they could only do 40, 50, 60 tests a day. It's tough. We were fortunate to have a research instrument here for a hepatitis C testing. Dr. Andy Talal and the labs here had worked on what we call a good lab practice clinical trial testing machine. And that Abbott machine We were able to pivot on that and within a couple of days spin up a EUA test on that machine. That's what we've been running on for the past 10 plus days, almost 2 weeks now. And we're up to, we do 188 assays in a day on our best days right now. And we're looking to get that into the 270 range in the next couple days. Our goal is to test, as you said, the hospital workers, the critical hospital workers, patients with critical clinical situations. In terms of the need, I think that's probably a reasonable projected need, although I have colleagues in downstate at Northwell, for example, that are doing 3,500 tests a day, and it's still not enough. So it's a little hard to know exactly the scale, but I think getting us over 1,000 is probably a good goal.
Dr. Tomaszewski, I know the staff has been working very hard the last couple of weeks. Any special messages for them as you guys work on moving this to a more public platform?
I do want to make a big shout out to the laboratory professionals who are doing this testing. There's very few of them. Some of them were captioned in the Buffalo News. There's a few more of them. And these people are absolute heroes. So I'm enormously thankful for their work. They're doing incredible jobs and in time of stress.
Dr. Tomaszewski, thank you for all that you guys have done for the community with your lab staff and all the testing. We realize you have an awful lot going on. Thanks for taking the time today.
My pleasure. Thank you, Mike.